Hi, I am Dr. Lohith. I am a consultant surgical gastroenterologist, a bariatric surgeon and a geo-onc surgeon from Manipal Hospital, Sarjapur Road. Today I will be speaking about obesity and its complication and how we treat in our specialty in our department. Obesity is basically an endemic at present in India. How do we grade obesity? Basically we use an index called body mass index, which is used to grade obesity. It's an easy calculator which can be found on internet, which uses height and weight of a person to calculate the BMI. Any BMI more than 35 is called morbid obesity, which is actually the most important part of obesity. Anything less than 35 BMI can be managed medically, whereas BMI more than 35 requires some kind of intervention. So moving on to morbid obesity is basically a very significant disease of a patient than a condition which is associated with multiple other complications like diabetes, hypertension. It may lead to stroke, it may lead to a cardiac MI, it can lead to sleep apnea syndrome which causes lack of sleep. It can lead to depression, like 25% of morbidly obese patients can be depressed, and also infertility. So any of these can be associated with morbid obesity. Hence, treating morbid obesity can also treat any of these associated disease. In India, it is known that the disease morbid obesity is prevalent between 3 to 8%. Moving on to its management, obesity is mainly managed medically, which includes diet and exercises. Exercises included 45 minutes of daily exercises, 4 to 5 days in a week at least. Exercises could be a simple brisk walk, a jog, it could be cycling, it could be a treadmill. At least 45 minutes in a day is a must, 4 to 5 days in a week is a must. Coming to diet, what is more important is avoiding high carb, fast food diets and skipping meals. That is what is more important. Another important thing is to have a balanced diet, not just proteins, not just carbohydrates. The diet should be well balanced. So if it is difficult to find a balanced diet, it is always better to meet a dietitian to find a balanced diet. When do we have to meet a specialist for this? Is basically when the BMI is more than 35 or when the person is not able to lose their weight irrespective of the best efforts. That is when you meet a specialist. We usually start with diet counseling, and we also rule out medical problems which can lead to obesity like thyroid, hormonal imbalance, genetic issues. So we try to treat them and then try to reduce the obesity if possible medically. If not, if the BMI is more than 35 and there are known associated comorbidities like diabetes, hypertension, cardiac diseases, hypertriglyceridemia, that is when we try to opt for surgical management. We usually start off with gastric balloons which can be placed through an endoscope in a patient whose BMI is around 35. When the BMI is much beyond 40, that is when these kind of surgical interventions are required. Surgical intervention includes sleeve gastrectomy, which basically is making a small sleeve of the stomach, and where the appetite of the patients reduces post surgery and they lose sufficient weight which is required. Then comes the bypass. Bypass is where the small pouch of stomach is created and the intestine is bypassed. There are two types of bypass. There's Roux-en-Y gastric bypass, and presently there's something called mini gastric bypass. Both of them have excellent results with remission of comorbidities, especially diabetes, hypertension and hypertriglyceridemia. It can even cure infertility in some individuals. It can cure sleep apnea syndromes in many who really have it, and that's how we treat it. So what is more important is to know when to ask for help and to understand what is morbid obesity and treat it accordingly. Thank you.